Carissa Etienne, and we have Cuban's health
and we
minister,
have
Etienne,
Cuban's health
and we
minister,
have Etienne,
Cuban's health
and we have
minister,
Etienne,
Cuban's health
and we have
minister,
Etienne, AIDS, Dr. Miki Chopra from UNICEF, and Dr. Adele Benzakan from the co-chair of the EMTCT. And to start off this ceremony, I'd like to pass the baton to our director, Carissa Etienne.
Thank you, Derek. So, as we said, we are gathered here today for what is a historic achievement, and the fact that Cuba is the first country in the world to have achieved the validation and certification of the elimination of mother-to-child transmission of HIV and syphilis. We have said that this is significant, that it is significant because not only it is the first country in the world, but it is a country where there is a long history of universal access to health and universal health coverage and strong health systems based on primary health care. We believe that this has helped to a large extent the achievement of this goal. It is inspiring for countries of the region who in 2010 took the decision that they would together move towards the elimination of mother-to-child transmission of HIV and syphilis by 2020. It is indeed an inspiration for the rest of the world. And as we heard earlier, it is hope that it is possible. It is possible to halt the elimination of mother-to-child transmission, but it is possible. It may be not so close, but it is achievable that we can turn the tide on this epidemic. And certainly this region is looking towards setting the targets of elimination of HIV from this region. It is something that is ambitious, but we are sure that with the sustained commitment of our governments, with the sustained commitment of our healthcare workers, with the sustained commitment of civil society, and with the sustained support of all of our partners, PAHO, UNAIDS, UNICEF, PEPFAR, Global Fund, CDC, that together we can ensure that we confront this epidemic and that we can halt this epidemic. So really it is my great pleasure to have the privilege of presenting this validation certificate to the Minister of Health, Dr. Roberto Morales. It is, and I will read, it is the validation of elimination of mother-to-child transmission of HIV and syphilis in Cuba. We have the honor to inform you that based on the assessments of the situation of mother-to-child transmission of HIV and syphilis by the Regional Assessment Team in March 2015, the subsequent WHO expert review, and the final recommendation from the first meeting of the WHO Global Validation Advisory Committee on the elimination of mother-to-child transmission, WHO has validated Cuba as a country where elimination of mother-to-child transmission as a public health problem has been achieved. The EMTCT validation status of Cuba will be published in the WHO Weekly Epidemiological Record. The validation of EMCT as a public health problem refers to the situation at present, and Cuba is expected to continue reporting on the maintenance of EMTCT validation indicators on an annual basis to WHO. And this validation certificate has been presented by the WHO to the government and people of Cuba. And so my distinct pleasure, Senor Ministro. That's what it is.
Este es también el reconocimiento.
This is the recognition of the people and government of Cuba and the healthcare workers for the contribution that the Pan American Health Organization has given us in this and other achievements that we have had. Thank you for your advice and your assistance over all these years. So this is our acknowledgement. And this is this shows the satisfaction that families derive from a healthy baby being born.
Después, ¿no? Hay una presentación, señor.
Dr. Tien, would you like to introduce our next speaker, which is the Cuba Health Minister, please?
Well, it is my privilege to introduce the Minister of Health of Cuba, Dr. Roberto Thomas Morales Ojeda, who himself is committed to the well-being and health of every Cuban national, and beyond that, to ensuring that other peoples outside of Cuba also benefit from all of the knowledge and the human resources that Cuba has developed. Dr. Morales Ojeda was the president of the World Health Assembly in 2014, and he passed on the baton in May of 2015, and he performed his services then with distinction. So it is my pleasure to welcome Dr. Roberto Thomas Morales Ojeda, Ministerio de Salud de Cuba. Señor.
It's truly a great honor for us to be here today at the headquarters of the Pan American Health Organization, receiving this certificate, which is the result of the validation of mother-to-child transmission of syphilis and HIV. And this is something we do with much pleasure and satisfaction, because this makes it possible for us to represent all of the authorities of our country, and to do so also on behalf of our people and the 500,000 health care workers that we represent, and this huge army of healthcare workers that are operating in so many different countries. I can ratify that the priority that our government has given ever since the revolution triumphed, the focus we place on health and the improvement of the health system and transformation to ensure the highest levels of well-being of our populace, and in this way to be able to contribute to a model that is rooted in primary health care and also the family doctor and nurse program, which doesn't only work on the mother-to-child program, but the challenge of communicable diseases and the main causes of death in our country, which are non-communicable chronic diseases, which are cancer, heart and vascular diseases, which continue to be a challenge that we continue to strive to overcome to ensure a life expectancy of 80 years, and 19% of the Cuban population does have over 70 years, is over 70 years of age. And so to have a healthcare system that can tackle this challenge is a priority that we set for ourselves. Without a doubt, this result that we see here has made it possible for us to validate that in the 50th Directing Council, the goal we set for ourselves is doable. That's why I think that this is the time for us to prevail upon all countries of the region to try to meet the indicators, to request the validation so that they too can take part in this exercise, as I said earlier, in the responses I gave to some of the questions that were asked. This is also time for us to continue striving to perfect our healthcare systems. I would like to thank Dr. Carissa Etienne, and I also thank everyone else presiding over this activity and the public in attendance. I would thank you for the very ethical, professional way you have covered this event. This is going to be a sustainable achievement, these results, and every verification that you engage in, that we engage in with you, will be a top priority for us so that we can continue to achieve the highest levels of results for Cuba and for the world. Thank you very much.
Thank you, Minister. I would also like to introduce our, as I mentioned before, our Dr. Luis Lourdes and Dr. Miki Chopra, who I believe have a certificate for to present to the health minister. And Dr. Luis Lourdes will also, who came directly from Geneva, correct? Thank you for coming all this way. Will explain what it means in terms of the fight against HIV globally and from the UNAIDS perspective, and Dr. Miki Chopra as well. Dr. Lourdes?
Thanks. I have a letter with me here, Minister, signed by Michelle CDB from UNAIDS, Margaret Chan from WHO, and Anthony Lake from UNICEF, the principals of these three global organizations. This letter, in a nutshell, is the full appreciation that the elimination of the transmission of multi-child of HIV in Cuba that's being celebrated in Paro and with Paro is the beginning of the AIDS epidemic, is the beginning of the end of the AIDS epidemic. It's not, should not be taken as business as usual. That's exactly the change of business that may bring us to the end of this epidemic in your lifetime. And having, starting the end of AIDS in Cuba, has a special, bring a special message to all of us. Not only that there are things that make a difference in terms of health outcomes. That's our option in our hands, is our option in the hands of governments, of societies, to go to a better or a bad health outcome. When you combine political decision together with social mobilization, empowerment of these people to define their own health, and of course, and when you invest on independence, as in the case, for instance, of producing commodities and taking over what's of interest of our own people, health outcomes will be always better. That's the lesson to learn. It's not geography. It's not an issue determined by low prevalence. That's actually a positive aspect of Cuba. What is defining this outcome is the response that Cuba made to AIDS since its very beginning. Cuba is in a region today that's the second most affected by AIDS after sub-Saharan Africa. It was not geography. It was not the sea around Cuba that made your outcome different. It was what we have done about this epidemic. And that's where the lesson is for all of us and for other countries to go. I handled this letter to you, but that's take me back to 2003, when I met your president at the time, President Fidel Castro. And he was telling us about international solidarity as a way to move towards a better world. And it's on this note, Minister, that I have a task to you. And I expect you to lead us now to also to fast-track the sharing of your experience with other countries in the world. That's so much needed. There is no development, and we are enter a phase now that we are setting the new goals for development global. There is no society that you develop leaving the new generation behind. This is the beginning of a new development, is to make sure that we are taking care of the generations to come. And in the terms of HIV/AIDS, Minister, you are giving us, at the best way possible, the hope that we are going to do so. But the task is global, and this letter brings to you the expectation and that you'll be helping us together with Carissa, for sure together with Sparrow, in bringing this experience to the rest of the world. In your words before, la concepción internacionalista. This is the concept that you take us to the end of AIDS. Thank you very much, Minister. I hand to you the letter with my colleague, Mike Schultz.
Queremos hacer la entrega también por toda la contribución.
Thank you very much.
Una obra de un artista que también refleja la felicidad y la alegría materno-infantil.
Thank you very much. Thank you. Gracias.
Dr. Chopra, do you have any additional remarks? Well, I just want to thank all of you. That's wonderful artwork there that I know that we'll all enjoy here at PAHO, the piece that was given to Carissa Etienne. And in any case, just want to thank all of you for your participation in this part of the event. There's nothing better than faces and voices from the field to understand the achievement that we're celebrating here today. And to introduce that story, to give a little more context from the field and what Cuba has been doing to become the first country in the world to receive this validation, we have a video called Born Free of HIV, a 5-minute video now that we will share with you. So please join us.
Estuve muy para y quise tener conmigo. Y ay, gracias a Dios, cuando el médico me era muy médico, Sammy. Nosotros estamos teniendo anualmente un promedio de 1 o 2 casos de VIH/SIDA infantil y estamos teniendo anualmente alrededor de 5 3 o ningún caso de sífilis congénita. La estrategia de eliminación nacional tiene una plataforma que es las características del Sistema Nacional de Salud, la prioridad que tiene en el país la atención de la mujer, del embarazo y del niño, y esto ha permitido insertar las acciones específicas del programa de ITS VIH-Sida, en especial la estrategia de eliminación en esta plataforma de un sistema accesible, universal y gratuito que nos permite llegar a todas las personas para que reciban los servicios y prevenir estas enfermedades.
Tomándome el tratamiento a la hora, los medicamentos, las consultas, yendo a las consultas, sin falta, siempre atenta ahí con mis enfermeros ahí y doctores que me ayudaron bastante. Y así estoy, vengo a mi casa a verme cómo seguía todo. Y hoy en día todavía van a mi casa a ver cómo sigue. Y sigue mi niño.
Al momento de su embarazo, ella era una paciente seropositiva con SIDA, la cual estaba en su tercer embarazo. Tiene 2 niños sanos, que los tuvo cuando ella todavía no era seropositiva y decidió con su pareja, que es seronegativa, tener el bebé. Desde la primera consulta se le explicaron las acciones que había que hacer con ella para evitar la transmisión materno-infantil de VIH y se inició su tratamiento con antirretrovirales y a la hora de su parto llegó una carga viral, como decía, no detectable, que se le sugirió el parto por cesárea, como es costumbre acá en nuestro país, y ella lo aceptó, se le realizó la cesárea a las 38 semanas de embarazo y tuvo un niño varón que por todos los estudios que se me han realizado, el niño es sano.
Se le explica las ventajas y las desventajas de lactar a este niño, que lo más aconsejable es no lactar para evitar la transmisión vertical de mamá al niño por lactancia materna. Ella decide no lactar a su niño. En nuestro sistema existe una leche artificial muy parecida a la leche materna, que se llama la leche maternizada. Se le facilita la venta a un precio muy módico.
Los medicamentos que le dan de forma gratuita en la farmacia que está aliada al hospital pediátrico de Clínica San Miguel, donde ellos van todos los meses y buscan sus medicamentos con un tarjetón de medicamentos que no tienen el nombre del paciente para esto de la confidencialidad del diagnóstico sobre el número de casos índice, y puede ser ella o un familiar que le recoge mensual su medicamento.
Si tenemos, por ejemplo, si hay una muchacha que, por ejemplo, por su estado de embarazo no puede ir a adquirir sus medicamentos, nosotros lo que hacemos es que los recogemos en la farmacia y se lo llevamos hasta su lugar o hacia el lugar donde ella se encuentra, puede ser en el lugar materno, puede ser en su casa. Vamos también hasta las casas para darle un poco de ese apoyo emocional.
Se toman medidas con el bebé, a la hora desde que nace, se le dan medicamentos retrovirales, en este caso la cirugía cada 6 horas hasta los 42 días de nacido para evitar la transmisión.
Aquí en el estómago, en el abdomen, tiene lesiones.
Syphilis has been an old disease, but it can be easily eliminated with appropriate treatment. We know that. Now we aim to establish that. This would be a major accomplishment for all countries, for all peoples, and particularly for children.
Trabajamos mucho en base a la captación precoz del embarazo. ¿Por qué? Porque cuando usted capta precozmente el embarazo puede atajar a tiempo cualquier tipo de riesgo o de patología que pueda tener la mujer.
A mi edad de gestación ya he hecho VIH serología una vez, mi pareja también.
Desde jovencitas a las muchachas las preparan desde las escuelas, en los consultorios médicos de la familia, en la televisión dan muchos spots que salen hablando sobre ese tema.
These two diseases, congenital syphilis and vertical transmission of HIV from mother to child can be eliminated.
Bueno, pues para las futuras generaciones deseamos un mundo libre de estas enfermedades que son prevenibles y que todas las familias cubanas y todas las mujeres y parejas cubanas que quieran tener un niño pues continúen teniendo acceso a estos servicios para que el final sea un niño sano, feliz y una familia también llena de felicidad.
Yo lo que yo más quisiera, que ya lo sé, ya que mi hijo está sano, es lo más importante que puede tener mi hijo.
Thank you very much. I'd like to ask Dr. Maricela Lantero, Dr. Cesar Núñez, Dr. Adel Benzacan, and Dr. Massimo Ginidelli and Dr. Mary Cam, please, to come to the front for our panel discussion. Thank you and welcome again. So now we go from the field to the context that is behind the success of this historic moment. How did Cuba get there, and what does it mean to have a country that validates the elimination? To discuss all these topics, we have here today a very high-level panel of experts who are going to help us understand better how Cuba works towards eliminating mother-to-child transmission of HIV and syphilis, what we can expect from the region, and how does the process of validation works, and what's next. To join us, we have, going from right to left, we have Dr. Mary Cam, Associate Director for Global Activities, STD Prevention Division at the CDC. We have our own Dr. Massimo Ginadelli, who is Unit Chief of HIV, Hepatitis, Tuberculosis, and STI Unit here at PAHO. We have Dr. Maria Isela Lantero, Chief of the National HIV AIDS and STI Program in Cuba. Dr. Cesar Núñez, Director of UNAIDS in Latin America, and Dr. Adel Benzacan, Co-Chair of the EMTCT Regional Validation Committee. So I have a series of questions here. I'll ask, I'll try to direct them to one or more of you, but please join in and chime in if you have any additional comments about the question. Again, I will conduct my questions in English, and you should feel free to answer in your language of choice, that being English or Spanish, please. So, for Dr. Lantero, Cuba is the first country to have the achievement of elimination of mother-to-child transmission goals validated through a rigorous process. What is the significance for the national health system and for the national response to HIV?
Bueno, en primer término.
Well, for starters, for the national healthcare system, for the government of Cuba, for the Cuban people, this is quite an acknowledgement. The fact that we've reached these results is a culmination of a pathway we started going down many years ago in our country toward achieving comprehensive attention for a program of high priority for us, which was mother and child health care. Now, as was said in some of the first remarks this morning, this is the result of the integration of our different programs, all coalescing around a common goal. Programs of the utmost importance, such as mother-to-child transmission, and the fact that we didn't approach this from a vertical approach, but rather a comprehensive universal health care and primary health care approach. So this is a true source of pride and honor for us to receive today this recognition, which, of course, also entails a high level of commitment on our part to continue working and striving toward better yet results. This is also significant for our country from the standpoint of the human standpoint to receive this recognition, because what we're talking about is eliminating a public health problem that is two diseases that are a source of much pain for families and disruption in people's lives. So the fact that we've achieved this and take the commitment that this entails on this is significant as a human achievement and a duty that we now have to uphold the results we've achieved this far. That's interpretation we can give you right now of these facts. Thank you.
And I think that Dr. Kim and Dr. Benzaken could answer this question about validation, about getting WHO validation, the process of getting WHO validation, and our understanding is it was the first time that the human rights component was incorporated into this kind of a process. One or both of you would like to respond to that, please?
Yeah, the process of validation is set forward in documents that have been developed globally. I would say PAHO has really been the region of the world that has helped drive the global initiative, because PAHO had set forward processes even before other regions of the world or WHO set up the global validation. So I think our region should feel very proud. So the process sets forward requirements that both for program and for monitoring and reporting that countries should strive to achieve. And then countries who feel that they've achieved these goals can put forward an application for validation. And the requirements are really quite stringent. They require processes be achieved for a period of time over several years, and that the quality of the data is very high. And I might turn to Dr. Guidinelli or others at PAHO about the specific processes, but I think this is kind of the general framework for validation, are achieving these requirements.
Específicamente,
Now, specifically speaking, the human rights tool gave rise to much discussion within the validation committee, but it seemed to me that it really was well used in the field. We conducted interviews of all of the different healthcare centers, the polyclinics, the end users. We also held meetings with civil society representatives. I was with the team that went to Santiago de Cuba, and this was quite an emotional moment for me. Historical, I don't know if you know, but the mayor of Santiago de Cuba, that is the city hall building, is a historic building. And the meeting we had with civil society was in the evening, and we had more than 50 people from civil society in the city hall, and we spoke with those 50 people for more than 3 hours. And so what I was impressed by was that the civil society movement came out of these comprehensive healthcare centers that at the beginning of the epidemic were set up. And that's where they cut their teeth, and that's where they grew strong and came out of that first experience and set up these community groups. So the committee then listened to them at all levels, that is, the patients and those people who still live within these comprehensive care centers, right through to civil society representatives, men who have sex with men, homosexual men and women, people living with HIV. This is an organization that works with the government in the different activities. And we, that is the committee in the field, heard from all of these parties. I would like to chime in too, and what I would like to stress is that this is the first time a validation process entails or includes a human rights component, that is community participation as well, and one of gender. This is one of the things that makes this event so historic. It was one of the requirements that the elimination profile had to meet, and the country has succeeded in achieving that with flying colors.
Continue on that. When the letter of the Minister of Health came to the attention of our director in November 2013, we really had to accelerate, to step up and accelerate the development of a process, bringing in all the perspectives specific to the HIV community. And I think we were really tremendously supported by a culture of setting visionary targets in PAHO, and at the same time a culture of elimination that is not unique to HIV. I think in this very room, no longer than a few weeks ago, another celebration took place along the same line of commitment of the organization towards elimination of eliminable conditions. That was rubella. So what Mary said is true. We really had to push the agenda to accelerate the development of an infrastructure, of a know-how, and the process for this validation. But we were comforted also by being in the broader mark of public health processes. It's not the first time that we do elimination. I would like to thank our colleagues in EPI who have really a great deal of culture. I would like to thank colleagues in neglected tropical diseases who really have also a lot to share in terms of addressing these issues from a public health perspective. There's a growing culture in WHO in terms of elimination, and today we are probably stepping forward a concept which is relatively new. It's not elimination classical, it's not eradication, but it is elimination of a problem from a public health relevance perspective. Let's not forget that for this elimination, we do not have a vaccine available. We are not operating with a vaccine, which would be ideal, and it is usually the weapon that we have for many other transmittable conditions. I think we have really witnessed how available interventions, technology, there's no cure for HIV. There's treatment, but no cure. How can all these available interventions be maximized to achieve a goal which brings the transmission rate below 2%? And I think this is really an extraordinary achievement by all means.
Thank you, Massimo. On that note, can you and Dr. Cesar Nunez also speak about the relevance for the Americas and the for the dual elimination initiative?
Gracias. Y también retomar.
Thank you. I'd also like to talk about the fact that we're really talking about a dual or double elimination. The global plan talks about the elimination of mother-to-child HIV, but in the Americas, as Dr. Carissa Dian had said, the countries have to comply with the two eliminations. This is a commitment that was taken on at the presidential level. So the fact that a country of the Americas has achieved this helps us a lot. And this is homework for the minister to take this message back to your colleagues, heads of state of the region, other health ministries. They were the ones who back then signed on to this commitment for the elimination. This is the only region of the world, Latin America and the Caribbean, where at the level of heads of state, this commitment of elimination has been signed. There is no other region of the world that has done so at the presidential level. At the Summit of the Americas in Panama City, we had a conversation with Dr. Carissa about the fact that we're at an important point in which we need to take up the monitoring of this problem. Many countries have requested validation, Chile, Costa Rica, two that have been mentioned. Uruguay is on the list as well. I would like to see this as a snowballing effect that will make it possible for all of the countries of the Americas next year to feel proud and congratulate ourselves when we look at this 2011 political commitment taken on to see what we've achieved, the milestones reached. I would like to broaden our outlook here. This certainly is a historic achievement, that is the elimination of mother-to-child transmission. This is going to send a very strong message, I think, for the entire region, and why not other regions in the whole world. Our region has been the first to set for itself treatment and prevention measures. We'll be talking about this in a few months in the regional forum. This type of achievement, this type of news, success story, are key elements that can help us. But we can't drop the guard. This is still an active epidemic in the region. We're still at a critical phase in our response to HIV, and we have two possible scenarios. One of full control, perhaps the elimination of HIV transmission by 2013. This is a plausible scenario, but we also have a very negative scenario, and this will all play out over the next 2 or 3 years, which is, well, I would say the region is quite well equipped for this, but let's not forget that a large number of people continue to be infected every year, more than 100,000 every year, more than 50 or 60,000 a year die by amount of these affected with HIV/AIDS. And so let's hope that today's good news will galvanize people and strengthen the region's response to the epidemic.
Muchas gracias. What should countries do once they validate elimination? What should Cuba do to continue this momentum? Once it's now they've validated the elimination, but you don't want to step off the pedal, so to speak. Perhaps Dr. Lantero can shed some insight there.
Well, the first thing we're going to do is keep forging ahead. We're going to keep reviewing what we're doing to do what we do that much better. But this is also an opportunity for us to take stock of where we stand and to review closely how we're working, as well as an opportunity. Well, I say this is an opportunity because we've been doing this hand in hand with the validation process, and we have received some technical visits from PAHO, and we have looked into a series of aspects that we have to reconsider. We're going to continue with our antiretroviral treatment, We have to keep using it, but perfect the preventive strategy we have, perfect it. And this just goes to show, this today shows that prevention can work. Now, there are other actions that we will spur, such as optimizing our treatment so that we can reach the goals of viral suppression. At the technical level within the ministry, we are working on this, as well as the progressive development of our pharmaceutical industry, so that we can continue to support our treatment program. So this is a manifold approach, combined approach that entails our sector, that is public sector, or the ministry, as well as the pharmaceutical industry and others, so that we can build on this result and have it be a springboard for us. In the committee's report, there are recommendations. Not everything has been achieved at 100% level. That's why recommendations are made, and it's expected that PAHO then will monitor this on an ongoing basis. It's hard to keep up this achievement of elimination, to maintain it. So we can't take our eye off the ball, so to speak, and we need to continue, or it needs to continue enhancing its healthcare systems. 20 specialists came to the country, made recommendations. This was a very unique moment, a watershed moment, and I remember the issue of the algorithms and modifying them to address this. There are some feasible things that can still be done to enhance Cuba's healthcare system. Now, nothing I've said here runs counter to or diminishes the elimination, but certainly there is still work to be done.
Thank you. The success in Cuba brings thoughts like integration, inclusion into mind, and so in terms of antenatal care and mother and child health packages and things like that. From Cuba's perspective, what are the key elements of this seemingly straightforward approach? And then, so we can, to follow up, if we can then have lessons that are learned from other health systems that perhaps Massimo and Dr. Nunez and Dr. Mary Kim can comment on afterwards. Dr. Lantero, si puedes como contestar.
Please, if you...
of the seemingly straightforward approach for Cuba.
Now, the first key element is having a social system such as ours as a guarantee of universal health care. I should also say that this whole process, developing our national health care system, in the process there have been elements that are important, such as equity or equal right that people have to receive the health care they need, the human approach to health care, the technical aspect that we've had in bringing together different sectors to address the epidemic in which the healthcare system has played an important role. All of this also based on a gender focus, covering specific rights to health, and bringing all of these different sectors together under the aegis of the healthcare system that is under the view of a right to health, and to come up with a recipe that would work elsewhere would be hard to do. But there has to be a public health approach with an overall goal set in which there are incentives offered for universal access, equality, and access to health, in which all the countries of the region will adapt according to their own specific context and reality, in which we, as I have said, are more than willing to assist countries, sharing with them what we've learned.
Muchas gracias.
Thank you.
Pam?
Yeah, thank you. So this is a seemingly straightforward approach, ensuring women have access to health care. And this is something Cuba's done very well, but many countries in the world are doing very well. And it's reassuring to see that access to antenatal services, at least one visit, is increasing, certainly in the region of Americas, but around the world. But more is needed, really. And what Cuba has achieved is not just access to health services, but early health services, sufficiently early that interventions like HIV testing and treatment can take place before an adverse outcome occurs. So we want to bring women into services early enough. And also a sufficient quality of services that we can feel sure that these preventable conditions are treated. And that integration piece is so important. We've talked a lot about HIV. Certainly HIV is a huge issue around the world, and something, fortunately, that we are able to put a lot of funding into. But there was a very interesting article published several years ago out of Haiti that talked about avoiding HIV but dying of syphilis. What a tragedy when we go through the technical issues of preventing HIV, and yet that system did not allow testing for syphilis and treatment, which could have been prevented with a simple injection of penicillin. So simple, so straightforward, so cheap. But when services are not integrated, these are the kinds of things that happen. So what Cuba has achieved, though, is not just HIV and syphilis elimination, which is we're so excited about that today, but with their integrated services around antenatal care, more than just HIV and syphilis, we're talking about that basic package of antenatal services. They have really, despite being a country with limited resources, brought down infant mortality to rates that very wealthy countries have. So infant mortality overall is brought down. So certainly HIV and syphilis integration is, that important first step, but really we want integration for all services, which this really nice system of basic primary healthcare services, in this case focused on the woman and child, has been able to achieve, which I think is really inspirational and something that countries around the region and around the world can learn from. So I think that integration, we talk about it being straightforward, but making it happen in a really effective way is something that we all countries of the world are striving for.
Sì, tal vez continuando un poco en la misma línea.
Now, in the same vein, I think we were impressed during our visit in March to see how all these different services can be provided in a very routine way. Much stress was placed on the fact that Cuba has a policy of universal access, of universal coverage, but to see it play out on a daily basis really impressed us, really struck us, and to see how this same system doesn't require vertical interventions to achieve what are seemingly complex activities. There has to be much interaction and throughout the healthcare system. I would like to underscore how strong the information system in Cuba is, even though it's not thoroughly computerized or digital. It's paper-based mostly. That is labor-intensive still, but there was immediate availability of information at any level and at all times. An audit is conducted of every case that doesn't achieve the desired outcome. Every case of congenital syphilis recorded. There weren't many, just a few over the last 3 or 4 years, but every one of these individual cases was audited to see what went wrong and where, whose responsibility it was, what the failing was. Did the person not receive the treatment on time? And so that was all documented. And we saw that it's capable to pull the files on patients and see exactly what they have received by way of treatment. So this is a very robust system that any healthcare system could benefit from to help to articulate the different activities. Now, the integration of services is the pillar that underpins the response that we see here. Unfortunately, we don't see this level of integration in all the countries throughout our region. Now, certainly, this is a time of joy for us, but it's also a time for us to step back and take stock of where we stand. This morning, we've talked about some very important elements that were brought to bear in Cuba's response, the political commitment, but this is a political commitment that translates into the technical level, into the availability of economic and human resources, having the strategic information system. How often do we find ourselves that mother-child department doesn't talk to tuberculosis and doesn't talk to HIV departments? And this is something that's important when the time comes to providing services at the primary care level. There are different red flags here that are showing us we need to be better integrated. Latin America is seeing this. In the Caribbean, 25% of teenage pregnancy rate. Now, this is something that is a cause for concern and for us such as this. All the agencies represented here, the different governments, need to also seek out ways to better integrate. We're talking about the elimination of mother-child transmission, but this is a call for the greater integration of services. The renewed promises call, this was another message that was directed exclusively to these groups. I think we're on the right path. We are learning from the success stories such as this one, but we have to have a clear goal and pursue it. If we hadn't had the goal for 2015, we wouldn't even have known that we achieved it, not even in this case. And the same thing applies to large goals. We've got the 2030 elimination goal for HIV that this region has signed on to, at least for treatment, by 2020, and then we'll see where we stand regarding elimination. This is something we set for ourselves in Rio in August, and it's cliche. We said that standing together, we stand stronger.
Is there any other lessons learned from this that would be applicable to other health systems that anybody on the panel would like to speak to? Okay. We have a few questions from our people on social media who joined, and one of them, I think, for Adele or for Massimo, in Spanish, existe una pauta de autoaplicación.
Is there any way we can, or an application, or any way we can assess advance or progress made?
Pauta quiere decir una herramienta para... Sí,
Sí.
creo que el camino de la...
Now, you're talking about, well, this dual elimination has to be supported by the availability of tools. Yes, I do think it's very possible. The same methodology that was used for validation in Cuba, which ultimately we will use in other countries, is applicable. It can be applied in countries that want to conduct an assessment, and not only for the validation of elimination. It's the same methodology, the same process And so this is something, yes, that can be used, and there are many countries that are requesting this right now.
La pauta de
What we want is for the entire region of the Americas to achieve this elimination. That has to be the goal we set for ourselves, the guiding principle. And what I said originally, using the words of UNAIDS, let's not leave any country behind. So as Massimo said, even if a country doesn't make the formal request for validation, countries can still be validated to close the gaps. I think PAHO has in its work plan, that is included in its work plan over the next couple of years for the elimination throughout the region.
Yeah, I might also add that not every country in the world really has the robust primary healthcare system and the laboratory infrastructure that Cuba has. And there are some new technologies coming forward that could help countries that may not have laboratory capacity, such as rapid tests. So there are rapid HIV tests that have been available for a long time, and they're becoming increasingly more sensitive, better able to detect infection. There are also rapid syphilis tests available, and increasingly there's combination tests where there's syphilis and HIV on a single device that can make it very easy for people at the level of the healthcare facility or even in outreach situations, test people and identify infections and treat them right on the spot, not requiring a long transport of specimens to a laboratory that could take a long time in many countries. It does not in Cuba, but in some countries there's not that extensive laboratory capacity.
Thank you. That actually answered another question that was put in, so thank you very much. This last question I have here is, I would open it up to anyone who wants it. ¿Cuándo se puede hacer?
When can the biological diagnosis be of babies when the mother is HIV positive? The baby that's been exposed to HIV, there are tests that can be conducted at childbirth, but up until 18 months of age, there has to be regular tests, and that's at the age at which the baby produces its own antibodies, because transmission happens during the pregnancy, and when the baby is born, the baby has the mother's antibodies, which are positive, and so the first test might show a positive result. That doesn't necessarily mean that the baby's been infected. That's why we have this recommendation of halting the monitoring of babies who have been exposed to HIV. We're also recommending that this be done for babies exposed to syphilis. That is, so they can be followed up on. Now, the need for the mother to be treated, that happens during the pregnancy, during delivery, and also for the child after birth. That is the protocol for exposed babies. The results of the test upon delivery isn't important. The important thing is for there to be treatment during pregnancy, during a childbirth, and then of the child after it's born.
Yes, I was going to open questions up to the rest of the people, and of course the best person to ask one is our director.
Tengo una cuestión. We haven't mentioned a lot about stigma and discrimination, but how does that play an important role in both the elimination of transmission from mother to child, but also for the treatment and prevention of HIV/AIDS in general?
Gracias.
Thank you, Dr. Tien, for that question. Now, certainly, stigma and discrimination, this is one of the two pillars of the elimination of the 3 zeros. Now, this is a big challenge in the countries where people who live with HIV are the target of discrimination and stigmatization, and for that reason, they don't go to the clinics to be tested, diagnosed. Once they've been diagnosed, they're afraid to also be seen going to the center to get their medicine. And those of us concerned with mother-child transmission, there's a dual problem when the child isn't benefiting from the program for the same reasons. Now, I thought that today's achievement can't be an empty achievement. This has to lead to a tool that will help us show up concrete results in the elimination of HIV and syphilis in other countries, and the issue of discrimination does play an important role in this whole process. I can give you a concrete example from Brazil, which in the last year prioritized carrying out diagnoses in key populations, because we know that stigma and discrimination also takes place in healthcare centers. That is, as far as treating these key groups. So, starting March last year, our strategy has been to use the oral fluid, a quick test for HIV in key populations such as transvestis, men who have sex with men, gays, sexual workers, men and women, sexual workers, and drug users. 30,000 tests were conducted in this population in the course of a year. In addition to the high levels that we saw, or rates of positive results, and this is something that helps to show how important this approach and strategy is, and that is that 48% of this high-risk population which had a positive result had never taken a fast test, a quick HIV test. So the main lesson we draw from that is that we have to go where the people are and not stay inside our clinics waiting for people to come to us. I think this is a good example, but there are others. About how you can work with the key populations who are the ones who are most discriminated against and stigmatized. And of all those stigmatized groups, it's the HIV group that is hit hardest. Something else that was very interesting, worthwhile in our visit, in the preparation for that visit, was this human rights and gender perspective that we saw and have a clear understanding of what the impact of discrimination and stigmatization is. Now, this was one of the 4 thematic areas around which the committee organized its work. And there were experts on that topic also included, because PAHO, as a public health agency or office, has a culture of compliance and has had some great milestones in gender and human rights issues. And so this was a very interesting exercise. We had a combination of strategies. You had the legislative or the laws passed and so forth, and the visits with people and healthcare providers and patients themselves of HIV to assess the testing. There wasn't it's not mandatory testing, but also the reproductive health aspect. And all the other issues, whether abortion or interruption of pregnancy. This was a very rich exchange, and those of us who continue on the committee in Geneva discussing this, deliberating this, this has all been very informative for our deliberations so that what we saw here can be brought into all the different processes of validation applied in the future.
Any other comments on that or no?
Y bueno,
in our region, we have the challenge of an epidemic in diverse groups. I would imagine
They're riper.
Bueno, la eliminación de la transmisión.
So we go for the low-hanging fruit first. And so you go for the easiest targets first. And we're still 30 years into this process. We're perfecting this approach and learning from our lessons to ensure that this region, Latin America and the Caribbean, can continue to reach these goals, ensuring treatment and undertaking preventive actions in those groups who are the target of discrimination and stigma. And unfortunately, every week we hear some news. And the worst sign of discrimination are violent deaths that we see that particularly trans sexual women are exposed to, and other people affected by HIV.
It's from people here in the room. Can please give your name and...
Sure. ¿Cómo les va? Muy buenos días.
Maria Jose Cisneros Cáceres, represent the International Federation. My question is, what has the role of human resources and health been to achieve this success in Cuba? And what do you expect of future healthcare workers to sustain this validation? The main result and the participation of young medical students in this process can be seen in our case in the fact that the primary healthcare workers are a part of our, that is, these are students in our medical schools. And so they're getting their practical experience. And we see that they have their first exposure to what's being done in prevention of these diseases. And so if we were to take on, that is, all these students are graduating every year, and that includes other countries. Students, medical students who graduate from other universities. And so there is a double result added to this. And it's not that not only do we train our students, but students who come to our region already as doctors, who have already graduated. Now, the best evidence that we see here is that is, how do we, the success that we've seen in the doctors that come from other countries working in our country is a testament to what we've done here. Now, also, this viewpoint of the health care workers, these are people who've been turning gray in all the years that they have put into health care. They were trained this way. They've gone through all these different units of primary health care or the network of hospitals, and they themselves have been a part of this process, and they have built this comprehensive healthcare system that people come into from the primary health, but also into the secondary and tertiary level of health. And all of these different elements are integrated across the board in a horizontal way.
I think we're about out of time for today, but I'd like to, on behalf of our director and the entire Pan American Health Organization, I'd like to thank each of our panelists for your time, your insights, and for sharing with us, providing us more context about this historic event today in Cuba. And thank you to all of you here in the audience, as well as those of you online. We expect to have a replay available of this event soon. And from Washington, D.C., I'm Derek Fromson. Thank you very much.